What you need to figure out is, are you losing fat or are you losing muscle and bone? Body composition and monitoring is very, very important. I recommend a registered dietitian where you can get some real in-depth type of monitoring. You've got to change your eating habits. You've got to add the resistance training. These are the things that you must do to use the drug properly. Hey, Mark Shankman back with you, and today I wanted to talk about the GLP-1 agonists. So your Mounjaros, your Ozempics, your Zepbounds. These drugs are a powerful tool that can be utilized pretty successfully. However, you need to do them right. You need to do them the right way, and unfortunately, the way that they're used in conventional medicine, they're not really used properly. And so many times a doctor will write a prescription for you. You'll go to the pharmacy, you'll pick up the drug, and you'll inject yourself once a week. But that's really about all that they tell you. And the reality is you need to do a few very important things along the way with these drugs. So first off, you need to get body composition monitoring. You can do pretty simple scales that you can buy over the counter. 25, 30 bucks can do a body composition monitoring. And but what you need to figure out is, are you losing fat or are you losing muscle and bone? Because the reality with these drugs is that you'll lose about 60% of your weight in fat loss. However, you're going to lose about 40% in muscle and bone if you don't do something about that. So body composition and monitoring is very, very important. I recommend a registered dietitian where you can get some real in-depth type of monitoring. But if you can't do that, you can do a simple, there's a one that my wife uses called a Renfro scale. You can get that pretty dirt cheap. But you also need to make sure that you're doing some resistance training. This is the most important thing that I think is overlooked. And if you're not doing resistance training, you're not going to preserve that muscle and bone that you can potentially lose. And if you're like me, if you're over 40 years old, I'm 56, then you're going to lose that muscle and bone, and it's going to be almost impossible for you to get it back. I mean, it's possible, but it's extremely difficult. Now, if you're in your early 20s, you probably can get it back. However, if you're middle-aged or above, you're going to have a really, really hard time doing that. And the other thing that conventional medicine doesn't do is they don't talk about nutrition. They don't talk about your eating habits. And here's the reality, the sad reality actually, is that if you go back to eating what you normally ate, or you never change in the first place, you're eating the standard American diet, which is a bunch of crap, then when you come off the med, and almost everybody does, within 1 year, like 70 or 75% of people have come off the drug. And the pharmaceutical company will tell you this is a treatment for life. This is not a short-term fix. And so when you come off the drug, your hunger comes back with a vengeance, and now you're really stacking that weight back on. The vast majority of people within the first year will put all of that weight that they lost back on if they come off the drug. So you've got to change your eating habits. You've got to add the resistance training. These are the things that you must do to use the drug properly. And like most tools in your toolbox, it is a very effective tool. However, you've got to do it the right way, and you've got to treat it properly. So hope you learned a little something. I'll catch you in the next video.